Do you know that vitamin D deficiency doesn't only weaken your bones, it can be also make your muscles weak, painful, tired, and unstable. Many people complain of body weakness, like difficulty in climbing stairs, complaining of pain and early fatigueness. But the hidden reason may be a low vitamin D. But how to exactly does vitamin D affect muscles? Let's understand the complete muscle mechanism inside the body. So hello everyone, welcome to MedVision. In today's video, we will learn about how vitamin D is essential for muscles and the pain. So vitamin D is not just a vitamin, it actually works like that a hormone inside the body. It play a major role in muscle strength, narrow signals, calcium absorption, and muscle contraction. When vitamin D level became low, the entire muscle system starts functioning poorly. In mechanism of vitamin D, the first we discuss about the reduced calcium absorption. We know that the vitamin D help the intestine to absorb calcium from food. This is the first step. Without enough vitamin D, the calcium absorption decreases and the blood calcium level may fall and muscle cannot contract properly because every muscle contraction depend on calcium ions. When the calcium supply became insufficient, the muscle became weak, fatigue developed quickly, and body movements became less powerful. This mechanism happened due to the reduced calcium absorption in body. We all know that the calcium is essential for muscle contraction. Without calcium absorption, the level is decreased and vitamin D also. And due to decrease of absorption, the muscle weakness occurs. Second, the effect on muscles. Muscle cell contain vitamin D receptors called VDR receptors. Vitamin D binds to these receptors and help the muscle protein synthesis, muscle growth, muscle repair, and the muscle fiber function. Especially type 2 muscle fibers. These fibers are responsible for power, balance, climbing stairs, standing from chair, and preventing from fall. When vitamin D is deficient, type 2 fibers became weakened and smaller, muscle performance decreased, and the physical activity became difficult. And next part is neuromuscular communication disturbance. Vitamin D also supports neuromuscular coordination. It helps nerve send a proper electric signal to muscle. In deficiency, nerve conduction became less efficient, coordination reduces, and the reaction time became slower, and the muscle may be heavy or unstable. Due to the decrease in levels, also increases inflammatory chemicals inside the body, and they cause muscle pain, body ache, tenderness, and the chronic fatigueness. Many people think that they have only weakness, but actually their muscles are inflamed and underperforming. Major causes of vitamin D deficiency in India. First is indoor lifestyle and lack of outdoor activity. Many people works on mobiles, laptop, tablets, and the modern lifestyle has significantly reduced the outdoor exposure. Most people spend long hours in office, school, coaching centers, homes, gym, indoors, using mobile phones or laptop. Because of this, the skin receive very little direct sunlight, reduce natural vitamin D production in body. That is the first common cause. Second is reduced sunlight exposure. Vitamin D is mainly product ultraviolet B rays from sunlight fall on skin, but however many people avoid going outside, stay indoor during daytime, or go out only early morning, evening, and when UVB intensity is very low. As a result, the body can't synthesize sufficient vitamin D naturally. So this is the second most common cause. Next cause is excessive screening time, office based work. We are talking about the computer, smartphones, and lot of people spend most of the day indoors, minimal sunlight exposure. Next is darker skin tone without higher melanin content. India's skin is generally content high melanin level. Melanin act as a natural sunscreen and reduce these skin's ability to absorb UVB rays. Therefore, the peoples with darker skin require longer sunlight exposure to produce same amount of vitamin D compared to the lighter skin tone. So this is the next cause. Poor dietary intake and vitamin D rich foods also may include. Few foods naturally contain vitamin D like fatty fish, egg yolk, fertilized milk, fortified milk, and mushrooms and cod liver oil. Many Indians consume insufficient amount of these foods, leading to inadequate dietary vitamin D intake. Nowadays, the air pollution blocking UVB rays. The air pollution and the smoke can block UVB rays from reaching the Earth's surface in higher pollution cities. Sunlight intensity decrease, UVB penetration is reduced, and skin vitamin D synthesis become less efficient in urban pollutions. Is now considered an important environmental cause. And some other causes are excessive sunscreen use, covering the body for full of clothes, obesity, and sedentary lifestyles. These are the different causes that also includes and poor gut absorption and some individuals and low physical activity levels, urban lifestyle and limited morning sunlight exposures, increased dependence on processed food like fast food, surgery beverage, and low nutrient meals also included. So these are the common causes which reduce the level of vitamin D in body. You can see due to the deficiency of vitamin D what happen in body, and this is the normal muscle group, and due to the deficit a severe deficiency in muscle became weakened and fatigued. So vitamin D correction, sunlight exposure, protein intake, and physical activity is necessary to prevent deficiency of vitamin D. So vitamin D deficiency does not affect only the bones, it directly affects the muscle, nerve movements, and the physical performance. That is why many people feel weak even without a serious disease. If the muscle weak continue for a long time, vitamin D levels should be always evaluated. So this is video about the vitamin D, its mechanism, and what happened due to its deficiency, and what are the cause factors of vitamin D in India. So thank you for watching Medivision. Thank you.